Hi everybody, welcome back, and I'm really sorry for all the technical challenges that we've had, but I've always been told don't work with children or animals, or now Microsoft Teams in terms of working for the media. But obviously my career in the media really probably bombed tonight in terms of my work, so I'm going to stick to nursing if I'm honest. So thanks very much for joining us tonight. We've unfortunately had some technical issues working with different platforms and trying to get this to work, so a huge apologies to those who have joined, didn't get on to the first webinar, but now have been able to join us today. So I'm really sorry about any of the technical issues, because I know we had originally over 3,000 people come onto the platform. So I'm sure that many of you are still here now, want to learn more about some of the work that we've been doing in relation to supporting students, particularly during the COVID pandemic. So joining me today on this webinar is Jessica Sainsbury, who is the RCN Student Committee Chair, and I'm delighted that Jessica's joined us today to talk about her own experience in terms of helping shape national policy and the student voice, and how important that is as part of the work that we've developed for the NHS, but also to talk about her own experiences of working in placement during the last recent weeks. We've had a number of questions submitted prior to this, and I've got them in front of me, so I'm going to use them as a bit of a framework for Jessica and I to talk through any of those questions. Unfortunately, we haven't been able to get both Ruth, Jackie and Andrea from the NMC onto this part of the webinar today, but we have agreed that what we will do is be rerunning the seminar and the webinar a little bit later on, once we've been able to resolve the technical issues. I don't think at 8:05 on a Friday night is the ideal time to really start to work through some further technical issues to do that, and I really want to make sure that we've got a lot of time to talk through many questions that have come from both the lecturers and also the academic staff, and also importantly our student colleagues, about their work, importantly their academic work, which is fundamentally important to us, but also importantly about how they are going to be supporting NHS and social care staff in relation to placements. And I know there are lots of questions, and I know your universities have been doing a great deal with you in terms of implementing some of the work that we've done nationally around the placements. But before I get started, I just wonder whether or not I'd just like to introduce my fellow co-host tonight, live from Southampton. If I can introduce Jessica Sainsbury, who is obviously the RCN Student Committee Chair. So I'll just get Jessica to introduce herself.
Hi everyone. Yeah, as Mark said, my name's Jess Sainsbury. I am a final year dual field student nurse, so I'm studying adult and mental health nursing at the University of Southampton, and I am also chair of the RCN Students Committee. So yeah, I have been living and breathing this with all of you as well, and also with the rest of the RCN Students Committee, but also the peer support networks that you've got available to you, mainly via Twitter. So you've got the Student Nurse Project, We Student Nurses, you've got students who are part of Unison as well. So all of us have been making sure that we feed back to the table where these decisions have been being made, your views, concerns and opinions.
Thanks, Jess. That's, I mean, from my perspective, one of the key things in terms of developing any national policy is to get the student voice actively involved, as well as also the academic staff and other senior nurses and midwives across the country. And it's been a really dynamic process. I do keep reminding people that we started engaging the Nursing Midwifery Council, who have been absolutely fantastic in terms of the support for students and making sure that all of the principles that we've set out in the national policy are focused on looking after the students, and also their both academic as well as also their personal welfare in terms of providing support or not, because obviously opting in or out is a voluntary process in the next part of the placement, which is quite critical to us. But also importantly, as Jess rightly pointed out, the involvement of unions, because we've obviously recognised this is a highly unusual environment in which to undertake placements. And some of the normal principles that we would apply to those placements really needed to be changed. And the Nursing Midwifery Council were very critical in that, in looking at elements of the NMC standards, all of which you are being trained under. But also importantly, the unions, including the RCN, Unite and others, were absolutely focused on the welfare of the students, making sure that where we had agreed to look at a paid placement to remunerate you for some disruption to your course, and also the hours that you would commit to the NHS and social care, as well as also other pastoral arrangements, including elements such as access to things like the pension whilst you're employed, but also our colleagues from the Council of Deans. So this is an organisation that your academic staff and your deans and also your organisations are members of, and are absolutely fundamentally responsible for your course, your education, and also the sort of development of your career. And they've been really key partners alongside Jess and the RCN, as well as also the NMC, in really focusing in on those really key points about making sure that you as students are supported in the extended placement time, but also that there is no detriment to your course and your academic attainment through this. And whilst it is a hugely unprecedented time, and we really do value each and every student who's going through our universities at the moment for nursing, midwifery, and importantly also our allied health professionals, it is really evident that actually a lot of our students wanted to contribute to the COVID response. But I also recognise that for many students, this was a really very, very difficult decision. And it wasn't through their commitment or their passion to nurse or be a midwife, but it very much was the fact that they were thinking about not only their own personal health, but also the health of others, including dependents. So I just want to be really, really clear that, you know, you are a completely valued member of the nursing and midwifery profession. I completely respect your decision that you've made to opt in or out of this process, and recognise that for some of you that was a very, very difficult decision. I've been following social media, and I know some colleagues of ours have placed their views on social media, and some people have felt pressurised to opt in. And I hope, alongside people like Jess, Andrew at the NMC, and Ruth May, our Chief Nursing Officer, and Jackie, that we've been able to give people a really strong sense that absolutely we understand that this is not for everybody, and there is no detriment at all. And we've been working with the Council of Deans, looking at the various different options of what that means for different courses. And I'll go through a few of those in a bit, because we've had a few of those questions. But first of all, I'd probably like to ask Jess to talk about her involvement in the student voice in developing this policy, and also the role that the RCN Students Committee has taken in terms of developing this, and also helpfully perhaps Jess, about your experience of going on placement, because obviously one of the areas, you're a mental health nursing student and have been working within your clinical practice area, which I think would be really valuable for others to hear.
Okay, so quite a few things there, so you might have to prompt me if I forget things. But starting off on how RCN students were involved with the negotiations. So obviously when the announcement was made about drafting in final year student nurses, because that was the initial announcement, I know obviously since then we've had changes to all year groups, or options to all year groups, but when that was announced, it was obviously a shock to us as well. So luckily within the Royal College of Nursing, we have this committee in place where you have students from different regions across the UK. The countries are all represented as well, so that we've got 4-nation involvement too. And then working with those student committee members, there are, you know, student ambassadors. So anyone who is a student member of the RCN can apply to be this, and that's how we kind of are the eyes and ears on the ground for what it is students are feeling, thinking, anything really. So yeah, so when the announcement was made, we obviously were asked to feedback what it is that students were concerned about, what we were thinking, what we were worried about. And we did that so via the RCN, but also via yourself, Mark, and it was fed up to the table where the chief nursing officers, the trade unions, the NMC were all discussing, you know, what are we going to put forward to propose for students. And what is, you know, really, really important is the fact that this is voluntary and there is choice around what students decide to do. So that's obviously a really big, I don't want to call it a win because it shouldn't be called a win, but you know, it's really important to note that. But then also it wasn't just you know, hearing the token voice. I haven't felt that at all throughout this process. So there have been many opportunities where as a committee, but also the other trade unions and peer support networks as well have been able to feed in through a variety of methods, through conference calls. You know, obviously it's difficult because we're all over the country at the moment, but social media is another one where we can feed in. You know, lots of students have been airing their concerns or thoughts or ideas, and we have been seeing those as I know, you know, HEE and the NMC have been seeing those. We might not be able to respond to every single comment that we get, but we are seeing them between us. So yeah, so that's obviously how we've fed in initially, but also it's important to note that this is ongoing still, and there are, you know, little snags that might come up or issues, but now we're in the position where the universities have been briefed and they are generally the first point of contact for students if they've got concerns or queries in regards to this. Obviously the RCN Students Committee are still very involved and we're feeding back, you know, what we're getting nationally too, for things like making sure students are on the right kinds of contracts, because there's been some questions around bank contracts or, you know, where the contracts are coming from, but also things like, you know, sickness, and you know, we're just starting these contracts, so would we be eligible for sick pay if we were to have to self-isolate due to what's going on with us or at home, and other benefits that you would get as a normal member of staff. So that's how the Students' Committee have been involved. I'm sure, Mark, you'll prompt me if I've left anything out. And then you wanted me to talk about my experience so far as a student.
What's your experience been like, Jess?
Okay, so I personally, I decided to opt in for an extended paid clinical placement, but that is because my circumstances allow for that. I was, you know, I was thinking, do I stay on my current course and then just see what happens with the placement availability? But I did decide, you know, with my family that, due to our circumstances, we, you know, none of us, touch wood, have any underlying health conditions. We kind of figured out a way to make it work, that I was going to do that. But I'm not going to lie, the night before my first shift, so I started, I've been on placement now for a week, because it was quite a quick process in my region. I know that hasn't been the same across the country, but in the southeast it's been pretty good with the trust that I've been placed in. So I had to fill in a form from my university, who then sent that to Health Education England, who then I believe sent it to Mark, correct me if I'm wrong, organised it with the trusts where we were going to go. We did have some kind of say over where we were going, and I was fortunate enough that I did get where I chose. So as I previously said, I am studying physical nursing and mental health nursing, and I don't know why, but it's been a surprise to a few people, but I decided to go for a mental health placement. But that is just because for me, I think my skills are more suited to that kind of area. I feel more confident in that kind of area, and also I, you know, along with others, do believe that the pandemic will hit mental health services as well. You know, the curve or the wave might be a bit later, but it will still have an impact on those services too. So we've been out for about a week. Obviously it's been a bit tricky with inductions. They're not how they would usually be, because you're just kind of limited to the area that you've been placed. But the team that I've been placed with, They have, helped. I've got a laptop already. I've only been there a week because it's a crisis team, so I'm not on a ward, so we're out and about, and all those kind of things have been sorted out, which has been great. And I've got a trust induction coming up as well. But the night before my first shift, I was really. I don't know. I was a mix of emotions, really. I was a bit frightened. I wasn't sure. I was worried about, am I going to settle in? Am I going to be a burden to these people? Am I actually going to be any use to them? But I was also worried about, my home life as well, and bringing back the virus to my kids. All of those things were going through my mind, and I am still concerned about those things. But now that I'm starting, what it's like when you first start a placement, it just takes that time to kind of settle in. It's just the added pandemic to it, I guess. So yeah, that's where I'm at the moment. They've sorted out all the bits and bobs so that I can be paid. So there's all those kind of things you need to think about too. But yeah, at the moment it's going okay.
Fantastic. Thanks, Jess. I mean, it's really, really helpful. And, I'm personally really very, very grateful for your personal leadership, and Amy and a number of student colleagues up and down the country who contacted me and were very, very clear about making sure the student voice was heard in all of the discussions in shaping the policy. So, it is really important, and I'm really glad to hear about your experience and also your decision-making process, because I think that's one lots of people have gone through in terms of understanding the implications for them as a student, but also importantly the implications on their family. So that's really helpful. Thank you. One of the criteria, one of the things that's probably quite helpful to explore is the different elements of the process and the policy. Because one of the couple of questions I've had, Alice has sent me a question which is about the year one students as an example in the undergraduate programme. One of the areas that we have long thought about was the different experiences that a student may have as a result of going into placement. And during the COVID pandemic, we've really understood that these are really highly unusual times, and we recognise that the demands on health and social care are quite significant, which means that there was, from our perspective, being really pragmatic, the inability in some circumstances to give and afford students the full quality placement experience that they would be getting at normal times, and that dominated the discussions between the NMC, the Council of Deans, and also our student leaders about what was the right thing to do. And genuinely we have thought long and hard about each year of different course programs and what they mean. So for many people, they recognise that in your first year of your nursing or midwifery degree, some of you will have had healthcare based experience before coming into these roles, but some colleagues won't have done, and that they may have only had limited exposure to a small number of placements at the point that we made the decision in March to go into practice. And it was felt both by the universities and also by student leaders and also senior nurses and midwives that that was probably not the ideal environment in which students in their first year in particular would be ideal to go into what is a really challenging environment. And I know that for many first year students, they've been disappointed by that decision, and I do recognise that, but obviously we were really cognizant of the fact that actually we had to look across over 50 different courses across England, different arrangements for curricula, and also importantly some students had not been out into practice at that point at all. So the decision was made that we wouldn't support through the NMC changes in the standards for first years to go into practice. However, I know that many students in their first year also do supplementary work as support workers, and our view was really very, very clear that if colleagues in their first year wish to step into placement in their first year as a support worker, then there would be provision within our local organisations for them to be able to develop, either get a bank contract, work for NHS professionals or others. But obviously from a learning experience perspective, the Council of Deans worked with the universities to recognise that there would need to be some arrangements put into place to ensure that the academic nature of the course programme could continue, and lots of flexibility was given by the NMC in terms of how we calculated the number of professional hours and how that could be developed, including the use of simulation as well as also the use of online learning, because I know many universities have gone to an online platform. To be honest, they may be slightly better than me when I'm trying to use Microsoft Teams, but it is a challenging environment, and pausing a course is quite a serious thing to do. So we worked with the universities to make sure that as many students could continue with their academic work as well as also gain other experiences. But under the NMC standards, unfortunately, any work as a healthcare support worker, independent of your programme, would not count towards practice hours. But of course, the NMC are being very flexible about how those hours are accrued. Now, of course, for second year students, it's a slightly different perspective, which is that many students by that point in their curricula would have had some exposure to both community settings as well as also in hospital settings if they're a physical health adult nurse, in paediatrics as well as mental health and learning disabilities. They would have had a wide range of experiences by then, but of course, not all of their academic assessments would have been completed at that point. So with the flexibility of the NMC's standards group, they were able then to be able to start to flex those opportunities, because one of the key things for us was to continue and make sure that you could continue to do your academic work as well as also potentially gain some experience. So the rules that the NMC helped shape were that students in their second year could do up to 80% clinical time in practice under the emergency rules and standards that had been put into place, but maintain contact with the university as well as for the 20% of time. Now, of course, some areas of the country have done that slightly differently. They've had a discussion amongst universities and their student body, and some universities have done 50% and 50%. Some have done 75% and 25%. So it is varied depending on universities, and what we've aimed to do nationally is give an overarching set of policy principles that support people making decisions within your institution, because as you can imagine, there are over 60 universities running nursing midwifery courses. Each of them may run a number of different branches, and each of those course programs looks quite different. But of course, again, we recognise that students going into that environment would be quite challenging in terms of that. So one of the slight rule changes in the standards that the NMC agreed to was that students must and should be supervised in practice. Now that is fundamentally important, but their supernumerary status may be adjusted depending on the clinical environment that they would be operating in. And I just want to be really clear, that's not about using students to put people into the numbers. That's about reflecting their contribution to care, but also reflecting the fact that supervision would look very different in that. And the NMC were very clear to us that all of those hours in that period would enable them be able to contribute towards their final degree. Now, the second years, we do have a group who haven't opted in, and I understand that completely. And one of the challenges about the opting out process has been making sure that local universities are really flexible to these changes and the needs of students. So we've got some real innovation going on in our universities, and we're continuing to work with the Council of Deans to make sure that that's reflected in course structure and programme. So for many students, they won't be able to access placement during the current period because of the reasons for opting out that I've described. But what the NMC have suggested is that there is flexibility in the approach of the university to ensure that any hours that aren't able to be delivered clinically during this period can be delivered through simulation, can be delivered through online other opportunities, but also importantly that there are still a period of over 18 months for the course to run where those hours could be accrued in other parts of the programme. So again, I just want to reinforce that this shouldn't be a concern for students in terms of their ability to progress from year 2 into year 3, because one of the things we've been really cited on is to make sure that you can continue with your academic work. Of course, the third year students, the majority of you would have had quite a significant amount of clinical expertise and experience at this point, and many of you were probably stepping into one of your final 2 placements, maybe an elective or a management placement. And so some of the universities have already completed most of their academic assessments at this point. Some are waiting for doing their dissertation while they're on placement, others are waiting for a final assessment and sign off. So the general view across the NMC, the student bodies, unions, and also the NHS and the Council of Deans was that the first phase would be to reflect the fact that those students stepping into this environment would be contributing to care, irrespective of the sector they worked in. And what's really important in that is we agreed, because of the level of experience and capability that you would bring to the teams you would work with, that it was only fair that you would be remunerated and paid for the hours that you contributed. Now, this sets up a slight challenge, and one of the things that Jess and her colleagues talked to us a lot about was making sure that all of the appropriate terms and conditions were absolutely embedded in the contract process. So whilst it sounds a little bit of a politician's answer, one of the things for me is that you are still students, but on a paid placement. So the universities must still, as part of the NMC rules, provide oversight support to you. You'll be working under supervision of other registrants in practice. You may or may not have fully supernumerary capacity. You would be being paid because of the contribution. One of the questions I get asked about a lot is well, how long is that, Mark? How long is this emergency going to take? The simple answer is we don't know how long the COVID pandemic is going to last in our country. We've seen really encouraging signs in the last 7 to 10 days where the flattening of the curve has responded, but sadly had a number of healthcare practitioners, nurses, doctors, scientists and others who have unfortunately passed away. And we also see still numbers of people dying in our hospitals and our community settings each and every day. So even though the flattening of the curve is starting to occur in some parts of the country, we are still very much in the grip of quite a serious health emergency. And there are 2 elements about timing for me. One is you as students. It's making sure that you as students are not disadvantaged for your onward progression in terms of your career and final graduation. So we are working with the Council of Deans, the NMC and others to look at how and if there is an opportunity for you to make sure that in the next few months that you complete all of your clinical hours on this extended placement, and at that point make a decision and choice about whether to return to university and completely sign off all of your activities and academic work to then qualify and register as normal in September. Or, and this is this is really important, is that this is really hard work, and it's only appropriate that students like yourself, after working 6 to 8 weeks in clinical placement, have a rest. You'll be dealing with quite some physically demanding and emotionally demanding work, and I think it's really important that we build a break in for you to step back and have some time off, but also, if that's required, slightly longer for you to be able to get some academic assessments done. If at that point we are still facing the quite serious challenge, we then need to work with individual universities and their course curriculum to identify what is the most effective next step for you. For many universities, that assessment is going to be relatively quick because most of the academic work is complete. Your final placement is really about completing hours. They will make an assessment and then a recommendation to the NMC, and it might be at that point it's appropriate for that cohort to step onto the full register as normal and then enter the workforce through NHS and social care or whatever provider we need to be. We also have the provision for something called the emergency register. Now, the emergency register is something that's caused a little bit of confusion, but essentially it's an emergency part of the NMC register which allows colleagues who wish to step on to an emergency part of the register to operate quite as a student, but quite close to the level of work that we would expect of a registrant, and that would give them all of the requirements of the NMC code. The NMC are taking an assessment decision in the next few weeks about the emergency register, and we will work with them on your behalf to give you information. But of course, we have to take that into account of not only you as students, but your individual course, and also the requirements of the wider NHS and social care. So many times I get asked the question, which is, when's the emergency register open? When can I join? The simple answer is it's available. We'll work with the NMC and Council of Deans. The second element is how long will I be on placement for? We will agree locally between your university and your trust how long to be on placement. But again, my guiding principle is your academic work, the service and contribution that you're giving, but also the rest that you will need as a result of working in practice. So we don't disadvantage you in terms of onward progression onto the full part of the register or the emergency register, if that's the decision that we need to make with you and your university, and also importantly any other institutions that are involved in this. So I've tried to hopefully explain how that works across the different year groups. And I know that some colleagues are working on a 4-year master's programme, and I've had a couple of conversations with colleagues who have said, how does this work for me if I'm in the final 6 months of my 4-year programme, or I'm in the final 3 years of those programmes? We've worked with individual institutions to work out where you would sit within that programme. So for some students who are on the 4-year programme, that if they're in their first 6 months, i.e. they started in March, then actually the principles to the year 2 group would apply to you, because again, each institution is different in terms of how their academic assessment is dealt with. And also importantly, those who are in the final 6 months of their postgraduate 4-year programme would be managed in the same way as those colleagues who are in the final years of their degree programme. So it is complex. We only worked with Jess and her colleagues and also the NMC back in the 25th of March. And here we are a few weeks later, and we have over 19,000 student, nurse and midwifery colleagues who have elected to volunteer to step and support NHS and social care. Colleagues like Jess have already started to work in those placements. And another question I've had is well, when will I go out on placement? Well, what we need to make sure is that each of the universities and the trust that you will be working with have got all of the elements in place that they need to do to make sure that they use your skills, but they do so safely. So those universities are making assessments under the normal placement rules to make sure that they know where you're going, they know that there is appropriate support in there. And from a Health Education England perspective, we're making sure all of the logistics are right, particularly in terms of things like payroll, making sure a local contract is in place for you to be assigned to working on this extended paid placement. And some colleagues obviously don't live near their university. They might live miles away or live in a different town entirely. So again, we're working through some logistics to make sure that the placement that you work on does still have academic oversight, whether you're in year 2 or year 3. So a student colleague of yours spoke to me very recently. They were working, they lived in Lincolnshire, but went to university in the Midlands, and we've just tried to broker an arrangement to make sure that the university in the Midlands is able to provide placement oversight whilst they work in their local hospital in Lincolnshire. So some of these issues take a little bit of time to work through, but I just want to reassure you that, again, we're in the middle of April. We still have quite a significant way to go through this process. Normal placement hours that are required are perfectly achievable over this next period of time. So we want to make sure all of those arrangements are in place and correct before such time as you go out into placement. So it has taken some universities and trust a little bit of time to work that out, but we are expecting the bulk of students to go out over the next period of time. Just one element, obviously, of the placement deployment is a number of second year students have contacted us and talked about the fact that their existing placement was due to start on the 1st of June. And some students are worried and saying, well, why aren't we being deployed now? Why are we having to wait to June to go out and work in clinical placement? And again, we're working with the institution, your university, about what is the best time to do that. Because actually sticking to your existing plan to support on the 1st of June might be for the local health system and your university the right thing to do. And actually it is really, really important that, again, we're not a detriment to your academic work, but we also are recognising that many of our clinical staff have already been operating now for 4 to 6 weeks during the COVID situation. They are going to need more support over the coming 3-4 months, and therefore different stages of coming out into practice are actually a logistic and good thing to do, as long as all of the appropriate arrangements are in place within your local system. So please, some students want to go out now, and I completely understand the kind of enthusiasm to support your NHS colleagues, but I've been told many times by senior leaders that this is a marathon, not a sprint, and the kind of impact we're going to want to have across the health system is going to need and require people over many months. Notably, certainly our second year students coming out at a slightly different time, our third year students, who many of them who are out in practice now, but also those who want to come out and get their academic work signed off, and then may wish to enter the proper part of the register a little bit later on in the academic cycle after having a break. So from a policy perspective, that's how complex this is. But it is really important to stress that absolutely this is about local trust working alongside their local universities to make sure that that fits well with your kind of experiences as well. Now, I've had another question in, which is that some trusts have indicated that students out on placement won't be paid under the rules of the pandemic work we've done. I have had this question raised with me today, in fact, by one institution. So if you are out on placement at the moment, since the emergency measures were put into place, the payment process will be accounted for with you. So I'm now working with a number of organisations that may have got that slightly confused, and I apologise for that, and we will work through that process. But all students who have opted in to work on extended clinical placement during COVID, whether they are second or third years, will come under the payment arrangements we've agreed, both with Jess and her colleagues, as well as also the national terms and conditions that were set out by our colleagues in NHS employers. And likewise, I know I've had a question today from Natalie about that, which is something I want to pick up to really start to explore if there are any particular issues that are not working out in the system effectively, to give you our kind of commitment about making sure that will be the place. So I've just got a few other questions. One question that's come up is, will the employing trust pay my wage, or will it be HEE? So it will actually be the trust that will pay the wages, because we need to make sure that the contract that you have and the arrangements that are in place give you all terms and conditions, not just the resources. The central government money will be given to the trust to pay for any salary wages that are incurred as a result of you being on paid placement for the period and duration of the pandemic. So again, I've been working with a number of trusts over the last week or two, just again reassure them about those kind of processes. But again, it isn't HE directly that will be paying. We are coordinating the process, but it will be very much down to the individual trust. So one question I've had in is, does this apply to student midwives? Unfortunately, we haven't got Jackie with us tonight because of the technical issues, but she did want to come on and talk about that. So as you know, with the midwifery course, it is slightly different, particularly in terms of the number of hours and the requirements within the structure of the programme, which does mean that there is a very subtle difference between how midwifery students are being placed, but the same rules apply. So if those colleagues from midwifery in second or third years work under the same principles, their supervision arrangements will be slightly different, but all of the terms and conditions will be fantastic. So I'm just going to pause there a moment because I think, Jess, you might have a couple of questions, but I've probably got one question for you, if I may. But did you want to ask me one question, did you say?
Oh, one question. Well, I have, I don't know whether I should have done or not, but I've kept my Twitter open and I'm trying to keep up with it. So a few people who might not have caught the beginning are just asking, that they missed the opportunity to ask questions. How can they ask questions? So we discussed this earlier, and obviously there are meant to be other guests on this with us, and that's going to be rescheduled. So I believe that after this webinar closes, that Health Education England will provide details on how people can submit questions ready for the next webinar, so that you've got all of those people, and hopefully myself and you again, Mark, so that people can make sure that they get their questions submitted. But there are a couple of things, if that's okay. I am conscious on time, but I do know that a lot of students are still very confused about the difference between the extended paid clinical placement and the temporary register, because they are two very different things. So just, in as plain English as possible, can you explain to
Oh
everyone
gosh.
the difference between them?
I have to say, I've had to have a tutorial from Jerry at the NMC on this. And you're right, Jess, to raise this, because it is something that people do get confused. And I'll be honest, I had to with it. So the emergency register is an emergency power that the NMC has enacted, which allows those students in their third year to be placed upon a new part of the register. So it's not the formal registered nurse part, it's an emergency part of the register. By doing that, it means that it hasn't shortened their course in any way. It has not truncated the requirements for their assessment, because they will still have to be assessed against the standards to come onto the full part of the register. But it would afford people, if they chose to do that and that there was a requirement to do so, for those individuals to operate as a registrant completely, independent of and also under supervision, but outside the arrangements of them being a student. So it would afford them to be able to operate as a registered nurse whichever sector they would do. But that temporary emergency register is an emergency part only, and whilst it's there to be used, it is important to understand that once those individuals are on that emergency part of the register, they still will need an assessment to get onto the full part. So the emergency extended placement allows students to be not only paid on placement because of the rules we put into place, but does allow them to work to the level of practice that the NMC can allow them to operate, and they can do themselves personally, which means that there are some scope of practice arrangements in place if you are on things. So some students may not have done their medication assessment by that point. So again, some students, as a scope of practice, may not feel comfortable doing the medications rounds, etc., or assessments of patients. And again, being a registrant means you do need to know where your boundary is. If you're on the emergency part of the register, then you would still be bound by some limitations to your practice, but you would be working pretty much as a registrant. One of the things about the benefits of the extended placement, of course, is that students would still be students on paid placement. They would still be required to have oversight. They would still be required to have a mentor. And what we've asked for universities to do is also their academic staff to support students in practice. So many lecturers have decided to work in clinical practice alongside their students, and others have decided to work in clinical practice to make sure that those assessments can be signed off appropriately and they get appropriate supervision. But of course, what we can't guarantee is full supernumerary status during their period of time whilst they're on extended placement. So it is very, very subtle, the difference between the two. But yeah, think of the emergency part of the register as being able to operate completely, almost like a registered nurse. But at some point, you would still need to be assessed to go onto the full part of the register.
Thank you, Mark. I also think it's really important to let people know that at the moment, the student part of the temporary register or emergency register isn't actually available, and we don't actually know whether the NMC are going to decide whether that is going to open to us. So at the moment that isn't an option, and I think that's where some of the confusion has been. So it's just really important to kind of get that message out there as well.
And we'll take those questions back. And I know if Andrea and Jerry were here, then absolutely they would be able to answer those questions in real detail for us. But of course, the NMC at this stage haven't opened that up, and they will work with yourselves and ourselves over the next few weeks to determine the requirements and the process to deliver that, if that is one of the requirements. And again, there's lots of factors to take into place. Is if people go onto the emergency register, how long would they go on for? Would that delay their progression and therefore their graduation from their course, and would that delay them going out into practice as a full registrant? All of these factors need to be taken into place alongside the emerging challenge that we have in terms of health. So we've got the ability, and we've got a process to assess it, and also importantly our NMC colleagues are going to be working with us over the next few weeks to determine what is the right approach and strategy, and importantly then communicate that both to universities as well as also importantly to students themselves.
Thank you for that, Mark. That's really helpful. Can I ask another question?
You're gathering them on a bit of social media, so this is good. I've got a few more here as well.
Okay, so this one, again, I'm really sorry for those of you who aren't final year last 6 months. I'm very conscious that although obviously Mark has covered for the other year groups, we are focusing on that a lot. So maybe that's something for the next webinar we can think about, how we kind of section it out so it's fair representation for all. However, I have had from quite a few people actually, for students who just can't opt in, so this isn't necessarily final years actually, it could be for second years as well, but if they can't opt in due to health conditions, or they can't get cleared by occupational health due to those things, how are we going to guarantee that these people aren't disadvantaged? And we have had some stories where people have had health conditions and the trust that they went for have been really flexible and have given them placements where they are at less risk. I know that's obviously really tricky to do, but that's not available for everyone. So what are we doing to try and make sure that people aren't disadvantaged because they've got underlying health conditions?
Of course, no, great question. And the issue for me is about their personal safety, importantly. And so what I'm in some ways pleased at is that there is individual assessments going on with people, and they're looking at a risk assessed approach, because that's absolutely the right thing to do. So we know that some people have opted in but might have dependents, and that should also be part of the conversation. Some people may be in the early stages of pregnancy or the latter stages of pregnancy, and again we need to think that, or they might have partners in that thing. So an individual assessment is really quite critical to do, to make sure that I think it's challenging to think about different risk areas, because of course we know from the evidence that some parts of the healthcare system are at far greater risks in terms of things like viral load, as an example. Although my personal clinical view is that all areas are potentially risk. That includes working in general practice, in nursing homes, or whether you're working in outreach like yourself, or crisis response. I think all of us are potentially exposed to it, but at different levels. So I think what's important is that an individual university course leader speaks to the student and looks at that risk before they go out. Sorry, it's my mum and dad ringing. They're not watching this, are they? So it's thrown me just ever so slightly. So yeah, one of the key things is to make sure the individual assessment takes place between the student, the academic staff, and also the trust, to make sure that if there are things that they can do to mitigate some of the risk, then they are able then to go on to placement. For some people, that's just not going to be possible because they can't. And so for all of this, we're working directly with the NMC and the universities through the council of deans to make sure that any flexibilities that can be used are used to either develop clinical hours. So as an example, the NMC have suggested lots of opportunities around both simulation-based training and other opportunities to gather clinical hours. Again, using hours over a much longer period period of time, and also importantly looking at the assessments in the standards against what the student has achieved already. So we are very cognizant of the fact that no student who opts in or opts out should be disadvantaged, and we're actually quite focused on those students who have opted out to make sure there is a way of assessing their both knowledge, skills and experience in a way that's consistent with the standards, and also delivers against the requirements in terms of the number of hours that is completed versus the standards in terms of being entering onto the register as well. So it will be subtly different for each university, because I know some assessments are done earlier than others. In fact, I was speaking to a university 2 weeks ago whose students were brought in to university, had 2 weeks in uni to sign off all of their final academic assessments, which meant all they needed to do is complete a series of clinical hours, and then they would have a break during the summer and go onto the register. But I know another institution, students went straight out onto placement, and are probably going to need to either do via remotely or through the university some academic assessment for them to be able to fulfill the requirements of the standards and go back on. So as students may know, that the universities across the adhere to the NMC standards in terms of their course, but of course how they deliver it is all very, very subtly different. So again, working with those institutions is quite clear, but the key thing is for students to be reassured that even on an individual basis, we will look at their risks, we will look at the experience that they wish or need as part of their appropriate sign-off, and importantly to make sure that they are not at detriment. They either can graduate as normal and as possible, or they can transfer from year 1 to 2 or years 2 to 3 as normal, or years 3 to 4 if they were on one of our master's programs. So again, we're really happy to listen and learn from colleagues if there are any issues that I personally pick up the phone to individual universities and deans where students have particular issues that we need to resolve. But the first point of contact is your course tutor, your university, because they're able to, under the flexible arrangements the NMC have granted, the ability to look at that course structure in a way that doesn't disadvantage the student at all.
Great, thank you, Mark. That's really helpful. And obviously, it's really, well, of course it's okay, but a lot of students are sharing their experiences of what their universities have decided to do, and it is different across the board, across the countries, and it is down to those individual university regulations, which is why as a committee from the RCM we are encouraging people to go back to their universities, to their programme leads, and just ask them, you know, thank you for letting us know that these are our options. Can you explain it in a bit more detail? I know I've personally done that at my university just to help me make that decision about whether I was going to opt in or out, or stay on my old programme or not. So yeah, that's really great. Thank you.
Yeah, and I've also had a question that's come in to me about terms and conditions. So one of the things that Jess, you and your colleagues and other union colleagues were very clear on is that whilst we've got this hybrid model of you being a student on paid placement, and we did that to give you the protections of being a student, but also to enable you to pay, was the terms and conditions that you would expect under Agenda for Change rules would apply. So that, as you rightly point out, includes enrolment in pension. It also involves the sickness benefits, as well as also importantly annual leave. So I can't quite remember the calculation, but for roughly every month in practice, it's a couple of days worth of annual leave which would be accrued as part of that time and work. And again, that's something that the local trust, and also importantly the local university, is important to take into consideration. But of course Ruth and others were very, very clear that if colleagues like yourself were on extended clinical placement and we didn't have full supernumerary status and you were delivering part of our service, it is important to reflect that in terms of terms and conditions equal to that of what your NHS and social care colleagues would have received as well. And if colleagues want to look at that, you can go onto the NHS employers website, and they've got a section on COVID support for students and elements of that on there.
I will actually look at that in more detail, because this is so the RCN Students Committee, we had a scheduled meeting yesterday anyway, and obviously the COVID response came up in that, and I know this is a very difficult subject to discuss, and I do want to do it carefully and sensitively. But obviously, part of, as a normal employee, your benefits package as such is a death in service benefit. And I know obviously we're very sad to hear about the death of one of our own, a student nurse aide, Raymond. Obviously, I don't know the circumstances around that, and the part of the course he was on, but that is a very real risk to students who are going to be opting in. So that's not something that we have had confirmed or anything yet. So if that's something that you could take forward, I know that's
so Jess, it's a good question. I've been speaking to the Department of Health, who have been given a very strong commitment that those students who would opt in would be enrolled both in the pension element as well as also the death in service element. So I will confirm that for you, but the principle I'm going into this is that will be afforded, because sadly a student may pass away, and that's deeply distressing, but we need to make sure those protections are in place for colleagues if they opt in to go into practice. I know I've been asked the question, if you don't opt in, will I get death in service and pension arrangements? And as you're not opting in and working, it is going to be slightly different, but of course I'll take that away, work with the department and get some clarity to support you on that one.
Thank you.
Any other questions coming in? I know we've probably got about 5 minutes left. Actually, I was supposed to be asking everybody else questions, and now Jess has turned into the interview, which is fantastic. Hijacked, which is brilliant. But actually, it's worked really well, Jess. So thank you very much for that. Has anything else come up on your timeline, or anything that to be asked? We can gather these and we can do them at a later stage, but.
Yeah, so one that's coming up quite a lot actually now that again, I'm really sorry for the students who've decided to opt out, but for students who have opted in, some people are getting role descriptors, and other people are getting nothing and just treated like a normal student, but you're just getting paid and you're not supernumerary. I know that there's been discussions with the NHS Staff Council, I believe, in regards to some kind of, role descriptor, so that it's clear what students can and cannot do. So obviously some of the things as a traditional student on the old version of the education standards, which is what this cohort would be coming out on, for example, a skill such as venipuncture and cannulation, we weren't able to do. So is there going to be something that makes it clear what students can and cannot do while they're on these extended placements?
Yes, it's a really good question. So on the NHS Employees website, the document on there, what it does, we have something that's slightly different, which is called a job profile versus a job description. And what we have in the NHS Employers Guidance, which is really helpful, is what is expected to be within the job description that a student on extended placement would be operating to. Now, that is different in different localities to reflect the nature of the type of work they do and the type of patients that they present, and also importantly reflect upon the skills of the individual and the student that would be working. I know that the NMC, we were having a discussion today, Jerry and Andrea are very, very keen to work on providing more information to support what a scope of practice looks like for students around delegation roles and technical skills, and that absolutely we need to provide a little bit more work on that. But what we've asked is that the NHS Employers, which is the agreement nationally with staff side, are adopted into local job descriptions with all of the wording that gives students the clear protection of being a student in employment gives, but also again a local assessment against the skills and attributes that those students will have based upon their scope of practice, but also in terms of where they are within their course structure. It will be very different. There's no, unfortunately, a kind of blanket rule that we can apply across the system, because again the courses are varied as well as also the institution. So to say everybody can do venipuncture would for many students go fantastic, great, I can do that, but for half of our students they may say I've never done that before as part of my course structure. So again, that needs to be kind of clearly taken in terms of their learning, their scope of practice, and also their supervision within the clinical environment.
Yeah, fantastic. Thank you, Mark.
Great. We've probably got probably got 2 minutes left for everybody. So I'm going to draw it to there because I've run out of water. And I just want to say a massive thank you to Jess for joining us tonight, being both host and compere and answering questions and really advocating on behalf of students and student voice. So thank you, Jess, for everything you've done in terms of your leadership and helping shape this national strategy. I'm really grateful for those colleagues who have submitted questions. We've got loads and loads of notes, which is fantastic. So what I'm going to do is I'm going to collate all those. Jess, myself, Andrea, Ruth and Jackie will come on to a future webinar, and you won't hear much from me then because I'll be sat back letting these guys talk. But I hope today's session has been really helpful. I hope it's given you a little bit more information. Please don't hesitate to contact Jess, myself and others, and we'll collate all of your detailed questions and make sure that we can provide appropriate responses. I hope tonight's session's been valuable. I'll be honest, I'm going to go and have a glass of wine now and a bit of a chill. But it's really thank you to all of you for joining us tonight. Massive thank you, Jess, and a huge thank you to two fantastic people who are sat behind a control panel on my computer orchestrating and trying to keep this IT system up and running so we're able to talk to you this evening. So thank you both for everything that you've done. I hope we have an opportunity to do this seminar in the next week or two and bring the other colleagues we had online so they can actually start to talk about it. So thank you very much, everybody. A massive thank you to the students, massive thank you to the academic staff and those who have joined the webinar tonight. I really do hope that you get some rest over the weekend, and those students who are starting in practice, good luck. Let me know how you get on, and of course if there are any issues then please don't hesitate to get into touch with us, and we'll absolutely work with our partners at the NMC, the RCN, the Councillor Deans to really helpfully make sure that your course, your experience and your contribution are well valued. So thank you very much, everybody, and thank you and good night.
Thank you.